Welcome, future nurses. We are jumping straight into this clinical bootcamp explainer, where we're going to translate immune disorder pathophysiology directly into exam success and, more importantly, clinical safety. I am so excited to walk through this with you today. We're not just memorizing a list of dry facts here, we are building the real-world clinical judgment that actually saves lives and will totally help you crush the NCLEX.
Here is our quick game plan for today. 1. Core concepts. 2. Hypersensitivity and priorities. 3. Managing HIV and immune efficiency. 4. Autoimmune clinical care. And 5. We'll wrap up with an NCLEX high-yield practice quiz.
All right, starting off with Section 1, Core Concepts.
To really get this stuff, you have to understand that our specific immune response is split into two distinct pathways. On one side, we have the B-cell-driven humoral response. You can think of this as your immediate defense system. It gives you quick protection against those acute, rapidly developing bacterial and viral infections by pumping out antibodies. Now, on the flip side, we have the T-cell-mediated cellular response. This is your delayed hypersensitivity. It kicks in for slowly developing infections, and it's also heavily involved in autoimmune responses and rejecting foreign cells. Grasping this basic division is absolutely key to understanding why certain immune disorders present the way they do in your patients.
Moving right along to Section 2, Hypersensitivity and Priority Actions.
Grab a pen because you're going to want to memorize this exact sequence for an anaphylactic reaction. Airway assessment is always, and I mean always, your absolute first priority, well before calling for help or giving oxygen. Anaphylaxis is this massive, systemic release of histamine that can cause your patient's airway to completely close up, right alongside severe hypotension and even cardiac arrest. So, you assess that airway first. Once you know what you're dealing with, then you immediately call the rapid response team, get oxygen flowing, establish an IV line with normal saline to fight that dangerous drop in blood pressure, and get ready to push life-saving epinephrine and difenhydramine.
Believe it or not, a tropical fruit salad can actually be a massive clinical red flag. A latex allergy very often means cross-sensitivity to these specific foods. Kiwis, bananas, pineapples, avocados, potatoes, hazelnuts, water chestnuts, and grapes. The whole reason for this is that the proteins in natural rubber latex are structurally super similar to the proteins found in these foods. So if you're changing a history and a patient casually mentions their mouth gets itchy when they eat a banana, your clinical alarm bells should be blaring. You have to immediately make sure every piece of medical equipment you use, from your gloves to the blood pressure cuff, is entirely latex-free.
That brings us to Section 3, Managing HIV and Immune Deficiency.
When we track HIV progression, it is all about that CD4 positive T-cell count, which is strictly broken down by these thresholds. And look, these aren't just random numbers to memorize. They literally dictate your patient's vulnerability. Above 500 cells per liter, the immune system is generally functioning normally. But the moment that count drops into the 200 to 499 range, you start seeing immune problems surface. The body is essentially losing its frontline defense commanders.
You absolutely need to burn this specific number into your brain, 200. Dropping below 200 cells per liter defines severe immune system problems and officially meets the diagnostic criteria for AIDS. At this stage, your patient is incredibly vulnerable to opportunistic infections that a normal, healthy immune system would easily swat away.
So, keeping that extreme vulnerability in mind, your literal #1 priority for immunodeficient patients is infection prevention, using strict aseptic technique. You are their protective barrier. And while you're protecting them from the outside world, you also have to be vigilant about opportunistic complications springing up from the inside, like Kaposi sarcoma. Keep a sharp eye out for any raised, purplish reddish-brown skin lesions. Those are classic indicators of this condition in folks who are immunocompromised.
Let's pivot to Section 4, Autoimmune Disorders Clinical Care.
Let's put two classic board presentations head-to-head here. Systemic lupus erythematosus, or SLE, is anchored by that classic malar butterfly rash right across the face, extreme photosensitivity, and a positive ANA lab test. The silent killer you have to watch for here is lupus nephritis, so vigilant monitoring of BUN and creatinine is a must. On the flip side, we have scleroderma, which is all about extreme fibrosis. It's defined by taut, shiny, hard skin that loses its elasticity and really dangerous fibrotic changes in the esophagus that cause severe dysphagia. To stop life-threatening reflux and aspiration, these patients absolutely must sit upright for a solid 1 to 2 hours after every single meal.
To round out the autoimmune side of things, we've got two more major threats you need to know. First, associate pemphigus with severe autoimmune blistering of the skin and a positive Nikolsky sign. That's where the epidermis just sloughs right off with gentle pressure. Second is good pasture syndrome, which is a really brutal condition where autoantibodies aggressively attack the basement membranes in both the lungs and the kidneys. The big takeaway here? Autoimmune diseases require highly targeted nursing interventions to protect whichever specific organs are currently under attack.
All right, Section 5, the NCLEX High-Yield Practice Quiz. Definitely pause this explainer on each question slide to lock in your answer before I go ahead and reveal the rationale. Let's kick this off with a high-stakes acute scenario about a severe hypersensitivity response. Look at your options carefully. What is the very first thing you're going to do?
If you chose B, amazing job. Securing a patent airway strictly precedes all other interventions, period. Before oxygen, before IV fluids, before meds. Remember the steps we talked about? Assessing the airway dictates every single action that follows, because if they can't breathe, literally nothing else matters.
Now, what's really interesting about this select all that apply question is how a simple dietary history can flag direct clinical danger on the floor. Think back to our tropical fruit salad analogy. Which of these share proteins with natural rubber latex?
You should have selected B, C, D, and E. Bananas, avocados, kiwis, and grapes. That's based directly on the classic cross-allergy profiles we covered earlier. Apples, which was option A, just don't fall into this high-risk cross-reactivity group.
Moving over to chronic autoimmune management. Think carefully about the most dangerous early organ complication for systemic lupus erythematosus. What specific lab values are going to alert you that this organ is struggling? Because lupus nephritis is such a severe early threat, keeping a close eye on BUN and creatinine is completely non-negotiable for client safety. Remember, CD4 counts are for HIV, not SLE. You always have to match the lab test to the specific organ risk.
Okay, this question is testing a direct quality of life and safety intervention for those gastrointestinal fibrotic changes. When a patient's esophagus becomes rigid and fibrotic, what simple mechanical intervention is going to save them from aspiration and reflux?
The answer is B. Eliminating dangerous reflux by keeping the patient upright for an hour or two is the exact targeted intervention you need here. Gravity is absolutely your best friend when esophageal motility is compromised by sclerosis.
For our final question, let's see if you actually burned that crucial HIV threshold number into your brain like we talked about. The lab result comes back at 150 cells per liter. What does that mean for your patient?
The answer is D. Anything below 200 indicates severe immune problems and meets the clinical criteria for AIDS. As we wrap up this explainer, I want to leave you with this final thought. How will mastering these strict clinical thresholds transform the way you assess your very next patient? Because catching a latex allergy from a quick diet history or intervening early when you see a dropping CD4 count, that is exactly what makes you an exceptional, life-saving nurse. Keep studying hard, and I will see you next time.